Thank you for pressing play on episode 62 of the Inside Deschutes County podcast. Wherever you might be and however you might be listening, thank you for making us a part of your day. You can subscribe on any podcast platform, and you can also find us at deschutes.org/podcast.
Deschutes County is an amazing place to live,
Ease of access,
work, and play.
Great place to raise a family.
I love the weather and the high density.
At Deschutes County, we provide excellent service.
Beautiful.
We're here to help you.
Deschutes County is the heart of Oregon.
Everyone wants to be here.
Welcome to the Inside Deschutes County podcast. I'm Eric Breon. Well, today we're sitting down with Holly Harris, the new director of Deschutes County Health Services. Holly has spent more than 10 years, probably a little longer than that, I think close to 13, 14 years, working in mostly behavioral health here in our community, and now she leads the county's largest department. Holly, thank you so much for being here. We have lots to talk about.
Yes, we do. Thank you so much for having me. I'm always thrilled to talk about the health department any chance I get.
Are you settling in?
Yes. I was fortunate to have been in the role for nearly 5 months before actually being in the position officially. So I've had a minute. I'm going, I'm getting settled in, I would say.
And so now officially in the role about 2 months.
October 6th, technically.
Have you come up for air?
I don't know if you ever fully come up for air in the health department. It is just nonstop.
It is kind of nonstop.
It is, yeah.
I spent 5 months in the health department, and I can kind of relate a little bit. It's nonstop. It goes.
It does.
Well, thank you for being here. You're coming into this role at a little bit of a challenging time, especially with some fiscal uncertainty. Are you sure you wanted this job?
Well, I knew what I was getting into, so I can't claim ignorance on that. I absolutely knew, and I think it was actually part of the reason I wanted to take this job. I just felt like the experience that I've had in the department, my having been there for 13 years, going on 13 years, really set me up to be able to navigate those challenges with our amazing leadership team together. I think if I were somebody brand new, having to figure out our community and our systems and all of that and tackle that, that would be probably pretty tough.
Well, you're not brand new.
No.
You've, as we said, about 13 years?
Yeah, going
Did
on
I get
13.
that right?
Mm-hmm.
Okay. 13 years. Well, can you share a little bit about how you got here? Like, take us back a little bit, because the reason why I wanted to have you on was to kind of introduce you to more people as the director of our largest department.
Yes, we are.
And with everything that goes on in the world of health. But take us back a little bit. Like, how did you end up at Deschutes County? How did you end up doing the work that you've done to get you to this role?
Yeah, it's kind of an interesting story,
A little
actually.
retrospective for you.
Yeah, it is. So I'm from Texas originally, born and raised, spent most of my adult life there. Actually,
South Texas, right?
Gulf
Texas,
Coast.
big state.
It is. It's a big state. So I was in the really, really humid part. So near the Gulf
Texas.
Coast. Yep. So that's where most of my family is, and my sister moved up here to Central Oregon about 20 some odd years ago, and we were just coming up here regularly to visit her, and so just ultimately decided that I wanted to be up here, and then my parents retired up here as well, so I was fortunate that way. But career-wise, spent my time in Texas, kind of started off at a domestic violence shelter doing some work there, which really inspired me to want to help vulnerable populations. The overlap with the criminal justice system in that work really led me then to some years, about 6 years, working in the criminal justice area. Ran a juvenile probation department in Texas for about 6 years. I was also a licensed professional counselor, so doing some of that work in addition to that. And so have loved, for most of my career, have really loved and appreciated the intersection of the criminal justice system and the behavioral health system, and that really inspired me, in all the work that I did going forward. So when I moved to Oregon, I knew I wanted to work for the county. I have been a long-time county employee for most of my career. I love working in local county government. I think you can really affect the most change in a local government like that in your community. And so I could not get my foot in the door, though. It was tough. It was a tough environment, especially 13 years ago. It was super competitive, and I just didn't know anybody. And so I took a part-time on-call position as a mobile crisis worker.
Oh, you took a risk.
I did. Because I had been a director of a probation department in Texas and just had to kind of start over here. It turned out to be the best decision I ever made. I spent the next 9 years in the crisis system, both as a employee, a staff, and then supervisor, and then manager, and then part of the development of the stabilization center.
Well, we'll talk a little bit more about the stabilization center in just a minute, but I'm curious, kind of how did those roles that you define kind of help shape your set you up for this job as now you're the director.
Yeah.
Now you're sitting in the big chair.
I am.
So what about those experiences made you feel like, you know what, I'm ready for this and I think I can affect some change?
Yeah, I think having been in every single role in the department leading up to the behavioral health director and then now the director, I mean, I have a perspective of I remember what it felt like being a staff member of a team trying to, do my job and the barriers that were in place at the time that affected my ability to do it sometimes. I remember being a supervisor and how challenging that role is and that you're trying to lead teams, but you don't always have the resources you need. And then managers leading multiple programs. And so all of it has led me to this spot where it hasn't been that long in the big scheme of things to have been in those roles. So I remember them vividly. And I think that broader perspective has helped set me up for success for this role. I hope so.
What about public health? Because that is maybe not as much of your background. Yeah. Is that the area where you're like, I've got maybe some learning to do, maybe some relationships to build? How is that kind of, because now that's a kind of a new undertaking and a big one as well, to kind of, okay, here's something I got to learn.
Yeah, absolutely. That is absolutely the place where I will have to do the most learning. There are pieces of public health that overlapped a lot with behavioral health. Prevention in particular has a lot of overlap in the behavioral health space. Emergency preparedness has a lot of overlap, actually. So there are places in which we have done a great job as a health department and collaborating and learning each other's work. I also am a type of leader who really leans on my experts, and we have an enormous amount of expertise in the health department, years and years and years of experience that will help inform me as a leader on how to run the health department.
Yeah, there's some really smart people.
Very smart people.
Oh,
Thank goodness.
I feel like,
yeah. And I don't think I wouldn't have been comfortable stepping into a role like this if I didn't know that we had such excellent leadership, excellent staff, and expertise within our department, and are really doing quite well. So it's a very healthy.
That foundation had to have been important.
It was.
Right.
It was for my decision making, for sure.
Yeah. Well, what do you think you've learned in the first couple of weeks now that maybe you weren't expecting as you've kind of made this transition from? I mean, it's kind of been a quick transition, really, because behavioral health director for 3 years.
A little or 2. I don't even know if it was quite 3.
Yeah. Then interim. And now you're here in this role. It's kind of a quick ascension. So what have you learned that you might not have been expecting? Not to put you on the spot or anything.
No, I don't know that. I mean, I think I am not. I mean, I feel like I know our organization really, really well. I think there hasn't been any major surprises, to be honest. I mean, I really, running the behavioral health part of the organization, it's the largest part of health services, 280 staff. So it's a significant portion of the health department. So kind of transitioning to adding more staff wasn't a huge leap for me in terms of, that. I think it's the variety of programs that we have. I'm actually in the middle of going to all of our teams and meeting with all of them, individually. And so that, right, I think as I go through that process, I'll be learning more on a kind of a team by team basis of what the challenges are that maybe I didn't expect. I haven't gotten through that process yet, though.
You know what I thought was cool, Holly, was the public reaction to your hiring.
Oh.
When it goes out in the media and it goes out, press releases and social media, it was like, Holly, right? I mean, that's got to feel good and kind of help solidify that decision, because I'm sure that was a tough decision to make the leap. And I think maybe even one that you put some extra thought into, because that role was open for a minute.
It was. We actually went through 2 external recruitments. And I did. I didn't just leap into it because I was looking to ascend to the top. That wasn't my motivation. My motivation has always been that I want the health department to be successful. And if I can contribute to that, that's what I want to do. And so it took me a minute and being in the role for a period of time to know that, to feel confident that I could contribute to the success in that way. I've had enormous support from the community. I've spent most of my career, I really value relationships. I value community partnerships. And when you invest in those and those get invested back to you, I think it can help you be successful.
So 400 plus employees
Yep.
in health services. Everybody's got their own, we want to do this, we want to do that,
Yeah.
especially when the new boss comes in,
Yep.
knocking on your door, like, I got an idea. So how do you define kind of what your strategies are for a department this big that has so much going on?
Well, I always welcome the new ideas because sometimes, particularly in a county government and a large organization, we can get stuck doing things a certain way just because we've always done them. So I am all about people saying, hey, why do we do it that way? Let's think about doing it a different way, or I've got an idea. So I do value that and I welcome it. I think we do have to have a strategy. We have a strategic plan. We have our core values and mission very clearly identified, and we really do make every effort to align the things that we are moving towards with those values. So, that's become even more critical as we kind of head into some, challenging times ahead with the fiscal uncertainty we're likely facing in the next couple of years.
Well, you were an idea person. The Stabilization
Yeah.
Center was a big idea.
It was.
Talk about how that kind of came to fruition and what its plans are for it moving forward, since you were such a big part of that.
Oh, thanks. Yeah, that was just an idea, and so that I do really value somebody who sees a barrier or a challenge in our community, and they say, "This is the resource I think we need to solve that, and let's figure out a way to get it." That's how that started. It was, I was on the mobile crisis team, and when I first started here, and I saw how many people were going to the hospital, but were getting released back to the community with nowhere else to go, and they just needed more time. And people that were having to wait for their crises to be managed or responded to because it was either law enforcement came out to see you or you waited until the next day to come see somebody. And there was a huge gap in our community. So seeing it firsthand as a mobile crisis person who was responding to those calls really kind of set me, I just knew that this was something that we needed. So it took several years. It took about 5 years to get off the ground, but we made it happen because there was a need.
Did that success of that idea kind of propel you into, I've got a lot more ideas that I can kind of start working towards? Because you got one from the ground up, got it going to where it is now. I'm just thinking, okay, what else you got, Holly?
I got a lot of ideas. I always have. I have lots and lots of ideas, but this is what I love about Deschutes County in particular, because not always in government can you get your big ideas to completion, because there's lots of reasons why things can't happen. And I feel like Deschutes County allows us to innovate. We're allowed to lead the state in a lot of the efforts that we do. And so, yes, I do have some, and as behavioral health director, we knew that there was a need for more residential care. We were making that happen. That still is happening. So there is still a lot to come. I think, it may be hampered somewhat by less resources coming our way. Some of those efforts were really great because we had some investment. A Stabilization Center wasn't necessarily, we had some investment to get kind of off the ground, but we didn't necessarily have huge investment from the state or anything to make that happen. So you can still get stuff done even without huge investment.
How do you talked about, we've kind of mentioned resources are kind of finite right now.
Right.
With maybe federal funding kind of maybe not what it used to be,
Right.
or going through some ebbs and flows of that.
Mm-hmm.
And then you've got ideas that probably require
Yes.
funding.
Yeah.
So what is the focus now? Is the focus on, okay, how do I get those ideas going and grow? Or do you focus more on what you have right now and make it great.
Yeah, I think that's kind of more where we're at right now is really we've seen a lot of growth in the health department over the last few years because of investments. Without investments, we're not likely to grow. Even with some investments, we may be shoring up some losses in funding. So we're really trying to maintain our core services, do it really, really well, make sure the health of our community is our priority. Because we are looking at some challenges. I've kind of got like the trifecta of concerning things related to our fiscal outlook, and between the coordinated care organizations and the challenges they're facing statewide, as well as the state budget forecast, which state agencies just had to do a 5% budget reduction proposal. And then, of course, we've got the federal stuff that's likely to be hitting us closer to 2027, 2028 with impacts to Medicaid, which we know impacts to Medicaid affect the health department pretty significantly.
How in the world do you manage all that? I mean, there's just so much in terms of, is it overwhelming?
If you get stuck in there, absolutely, it can get overwhelming. There are definitely moments where it feels overwhelming. I think we stay really focused on the people that we serve in our community. And that is what drives all of the staff that come to work for health services. It's what drives our leaders. We are really clear on what our mission is. So we stay focused on the mission. We stay focused on our values. We try to drown out the noise of the unknowns because there's a lot we don't know still. Like even with the federal stuff coming our way, right now it's sort of like, here's what's going to be happening, but we don't know the details of how it's going to be implemented or what the impacts are going to be. So we could get spun up about that right now, or we could just keep doing our work, keep moving forward, plan, be efficient, and we're definitely doing that. We are thinking about every possibility, but we are not letting it stop us from doing the work.
I mean, that could be the mission statement for health services, right? Just put it on the wall in the lobby, focus on the people.
Right. Yeah, that's what we do.
I mean...
Yeah, the people still going to rely, and they're going to need us regardless of what's happening at the federal level, the state level. Anyway, this is our community, and we have to show up in our community. We live here, and the people depend on us, so that's what we're focused on.
A lot of big issues, health issues nationally in terms of, I mean, we had a big pandemic.
Yes, we did.
We have a lot of talk about vaccines, availability, mental health, substance abuse. What do you think? I mean, those are probably all in the same category of being big issues, but what do you see as kind of the biggest?
Oh, goodness. I don't know if I can categorize a biggest. I mean,
maybe
they're
you
all
can't.
huge. Yeah, I don't think we can. I mean, certainly, some of the changes in how we receive information from the federal government is a challenge. We how the CDC disseminates information. Certainly, when there's a shutdown, all kinds of things are affected for us, and we're kind of navigating in the dark. Uncertainty around funding for programs when there's shutdowns or otherwise, those are challenges. But houselessness affects all parts of our community, both public health and behavioral health, significantly, and so that's, I think, continues to be a huge challenge that we stay involved and focused on. If another pandemic, I mean, when you think about resources being less, and if something like another pandemic or outbreak of some kind happen, those resources are really critical to be able to respond and get ahead of that. So that's something that raises concern.
Is there I don't know this, but is there planning for stuff like that ongoing? Like for what's next?
Oh, yes. I mean, that's, I
mean, I would assume, but I just, how much emphasis do you put on that when you're dealing with so much in the present?
Yeah. Well, you still have to do that. I mean, that's the work, right? Particularly, public health. I mean, they do like measles, tabletop exercise, trying to get ahead of this. Emergency preparedness still, heavily involved in a lot of their planning work. I mean, we still have to do the work and plan and be prepared because we don't know the full impacts of things that are coming yet.
I find the intersection between some of our biggest issues and like houselessness and, things that are maybe not in the realm of what you would normally consider as being a health problem. But there's an intersection there on a lot of that.
There is.
I mean,
We touch a lot of different parts of
it's really amazing, when it comes to, emergency preparedness and things like that. Talk a little bit about that and kind of the planning that goes into those things. But the intersection to me is really interesting because it's not, you wouldn't think health, but it affects so many people.
Oh, it does. I mean, there's so much behind the scenes work that happens, particularly in public health. When we think about, a wildfire event, I mean, the amount of communications and planning that our emergency preparedness is doing behind the scenes, while obviously the first responders are out there putting out the fires and shelters and all that stuff. So it's just a lot of unseen work that's really critical to help mitigate the impacts to people that are affected by those events. Behavioral health too. I mean, when people are affected by those events and they're struggling with their mental health and they need resources. Thank goodness they have a crisis center they can walk into, or they have a mobile crisis clinician that can go out to them. So we touch criminal justice, we touch schools, we obviously hospital systems, but we touch the sheriff's office, so many different parts of our community.
Yeah, I would think, and then it just takes you back to, okay, where do we get the funding for those things?
Yeah.
I mean, is that just going to be a nonstop challenge, you think, in this role?
Yeah, I think so. I mean, it has been since I started.
The beginning of time.
It's just never, you're never like just rolling in cash and
Money,
be able to
money.
do everything. It's just not a reality in a publicly funded system. You're always working with, at the minimum amount of resources because we want to use tax dollars efficiently. So it makes sense. You're not going to be just wealthy, but it's always, this is certainly a different phenomenon that we're facing right now.
I've always learned it's what do you invest in, what do you scale back, and what do you explore as new.
Yeah.
I mean,
this is the exercise we're going to be going through in the next, early next year. Is really what are our core mandated services we have to do? Because we are statutorily required to do a lot of things.
And a lot of people don't realize that.
They don't realize that. We have a lot there's a lot that's required of us. And the funding doesn't always keep pace, but there's a lot that's required of us that we have to do. And then there's some things that we do that are still very critical, but are not necessarily mandated. I mean, it's not actually required that we have a 24/7 crisis center. Like but we knew that that's what our community needs. That's going to be still a critical priority for us going forward because as people lose insurance, become unenrolled in Medicaid, they're still going to have needs. So we still want to make sure they have access to crisis services. So that's how we are going to align, what we maintain, how we move forward with our values and the people we serve.
Health in and of itself, and it's been this way, but it's always seems to be controversial. How do you manage? I don't want to get too much in the weeds, and I don't want to put you on the spot, and I don't want you to have to, say something that you don't want to say. But it is, and it's just a cruel reality of working in health. I feel like it is.
Yeah.
And how do you manage that? Because there's just so many different opinions about different aspects of health. How do you feel like in this role, that's an opportunity for you to grow personally, professionally, but then also affect the change?
Yeah, I mean, we do. A lot of in health gets politicized, and I think we try to stay out of that because we're just so not a political organization.
Don't want it.
We don't want it. We don't even think that way. We are real.
But it is.
It does. It comes part of every campaign. It's definitely part of election season. I mean, we come up every time the health department, not only because we're the largest department in the county, but just our topics that we deal with can, for some reason, land on one side of the aisle or the other in different ways. And so I think our strategy is, we just try to be really transparent. We are transparent with the evidence and the facts that we know to be true based on research and best practices. And, we share that information and we tell the stories and we show outcomes and data to support our work. And we let the chips fall where they may.
Oh, and they fall.
And they fall.
They definitely fall. Have you had time to think about your journey as you've moved into this role and just kind of look back and go, wow, this has been quite the ride?
Every day that I've been in this role. Literally, the day I was walking into my interview, I was walking across the parking lot of our Courtney building over on the east side, and I was having these flashbacks of the day I walked in at that Courtney building for my part-time on-call mobile crisis clinician interview in my suit and heels from Texas in the winter, could barely make it across the parking lot in the ice, and so I had a moment that day of just like, whoa, how did this happen? This is crazy, and even on the drive-in this morning, I was just like, yeah, I'm still pinching myself. I feel really fortunate. I'm honored. I'm grateful that people have belief in me and have supported me, and I'm just grateful to be able to work for an organization like Health Services. It's amazing.
Probably wearing more sweaters than suits.
Definitely,
now.
yeah. I've adapted the bend fashion style.
Are you getting a lot of feedback from the community partners? Huge part of what you do.
Yeah.
Working with other organizations around town in the county. What has that been like as you've kind of now stepped into this role?
Yeah.
More learning,
Yeah.
or is it more relationship building? What have you learned?
Yeah, the great thing is I had relationships with so many of our community partners. I mean, the nice thing about working in the crisis world for so many years was you really talk about touching the number of organizations in that space. So I had relationships even before going into the behavioral health director job. But I think now I'm in this role, I'm getting to meet with different people in those organizations that I've met with before. Really, I think we're all trying to pick each other's brains and collaborate and think about strategies moving forward collectively, because that's the Central Oregon way. We really don't do things in isolation. We want to do them together, and I think that's reassuring for somebody like me, newer in this role, and leaning on the expertise of some of our really brilliant community partners who have some great ideas about how to navigate this.
Is there anything in particular that gives you hope about health in the future of health?
Yeah.
In our community, in Deschutes County, nationwide, what gives you hope right now?
Yeah, I mean, I wouldn't be able to do this job if I didn't have hope, for sure. I mean, I think particularly for Central Oregon, I saw how we navigated the pandemic. I saw how we can collectively come together and do really, really hard things together and come out the other side, and in some ways come out in some ways better, like lessons learned, implementing things that will help us be stronger going forward. So that's the hope I have, is that yes, this is going to be hard. There's going to be pain and suffering through it for some of the people we serve and even for some of our staff. It's going to be hard. But I believe in the passion and dedication of the workforce we have, and I know that we are going to help so many people through this that we will come out on the other side.
Well, Holly Harris, thank you so much for joining us. It's really great to hear how your experience is helping shape this role and how the work happening in health services continues to evolve, even with the challenges. I really appreciate. Glad you're in the job.
Thank you.
So thank you for being in the job. Thank you for applying, even though you had to think about it for a minute. But we're just so glad you're here, and really appreciate the time today.
Yeah, thank you so much for having me.
Again, that's new Health Services Director Holly Harris. As she settles into her new role, there's a lot of important work ahead for public health and behavioral health in Deschutes County. We appreciate her taking the time to share her perspective. If you'd like to learn more about health services or explore the programs we talked about today, you can visit deschutes.org/health. We want to thank you again for listening to Inside Deschutes County. You can find us wherever you listen to your podcasts or at deschutes.org/podcast. But until next time, we hope you're safe out there and healthy.